Most elderly individuals have underlying conditions such as hypertension, heart disease, or diabetes, so they often worry about whether they're eligible for dental implants, especially full arch implants, and seek reassurance about safety and effectiveness. Of course, the answer is yes. Here we can address most, if not all, cases. However, there are some important considerations. First, the doctor needs to have tests and a detailed understanding of your current health condition. We need to carefully manage potential risks by conducting up-to-date blood tests to assess your current health condition. These results help us identify any concerns and compare them with previous tests to determine whether your condition has remained stable, improved, or worsened. This step is essential for safe treatment planning. Therefore, if you are coming from abroad or have had prior medical tests, especially blood work, please bring all previous results to your implant consultation, particularly for full arch cases. Having both past and current records allows us to better evaluate potential risks and ensure the safest and most effective full arch implant procedure possible. Secondly, we will need to consult with specialists regarding any accompanying medical conditions to reach a consensus on how to perform the implant surgery, particularly full arch implants, without affecting your overall health. For example, if you are being treated by a cardiologist for heart issues, blood pressure, or diabetes, we will typically try to contact that doctor to see if there are any considerations regarding your overall health that we need to be aware of. If the patient presents with underlying medical conditions but does not currently have a doctor overseeing their treatment, we may reach out to specialists with whom we have established relationships to evaluate how to proceed from a comprehensive medical standpoint prior to the implant procedure. This is crucial to ensure maximum safety and well-being for the patient. Here at our facility, we possess extensive experience in treating patients who have experienced full arch tooth loss along with various accompanying medical conditions. Our approach is firmly rooted in scientific evidence and best practices. For instance, a few years ago, we encountered a patient who was suffering from loose teeth as a result of periodontal disease, combined with type 2 diabetes that was characterized by elevated blood sugar levels. Prior to initiating any treatment, we conducted thorough blood tests and sought the expertise of an endocrinologist, which was followed by a brief treatment regimen aimed at lowering the blood sugar to a more acceptable level. Furthermore, concerning the periodontal disease, we exercise extreme caution regarding the potential for bacteria from the remaining loose teeth to infect the implant we intend to place. Therefore, we proceed with great care, ensuring that all infections surrounding the affected teeth are meticulously removed, thoroughly rinsed, and we administer preventive antibiotics both before and after the surgical procedure to eliminate any risks of infection at the implant site. In the end, that person had a full arch implant, which allowed for very good chewing and biting. This has been particularly demonstrated through a study where we followed such patients for nearly 8 years, showing a very high success rate of over 98%. We have published these results and the experiences we gained from treating these patients to share with colleagues both nationally and internationally to improve this treatment. Therefore, those with underlying health conditions can be completely assured that they can undergo full arch implant placement. Of course, for a successful case, we must be very careful and meticulous, screening for risks, consulting with specialists in related pathologies, and relying on a solid foundation of experience and knowledge from treating many different cases. Especially in these cases, when we treat patients from the very beginning, it is always easier than when we have to redo a case. Redoing procedures can complicate everything. The bone condition may worsen, or there may be chronic infections that are difficult to control. Additionally, patients may feel anxious and fearful about undergoing a second procedure after having done it once. Therefore, we must ensure thorough treatment before deciding to handle complex cases like full arch tooth loss.